Hi there, Dr. Gary here on the road. We sell dental practices nationwide. We are dental practice brokers. Today's topic is, under what circumstances should the seller of a dental practice permit the buyer to work in the office before the sale is completed? We'll get into that. As you know, I've been doing this for 14 years now, dental practice brokers. We have 10 employees. We're in 22 states, and we work every day except Christmas and Easter. Our number is 201-663-0935. Our website is dentalpracticeguide.com. And remember, all this information is for entertainment purpose only. It's not legal advice. So if you're going to sell to a large DSO, large corporate dentistry, call us first, because we know who the best ones are. They pay our commission. Also, when you work with us, we'll get your legal fees reimbursed upon successful closing. So give us a call. So we have a situation here that normally I do not advise a buyer is able to work at the seller's office prior to closing. It's just not a good idea. This is not the kind of thing you try out the merchandise. It's just not a good idea for the seller, especially. You have restrictive covenant issues, all kinds of issues that come up. I don't advise it. However, there are circumstances you'd be negotiable. There are circumstances which you might advise it. And this is one of those circumstances. The buyer has already signed the contract. We've not had the closing yet because we've got to work out something with the lease. But the buyer has signed the contract, so he has some obligations at this point. Now, the situation is the seller's health is a little bit compromised right now, and they really can't stay on any longer. They just have to go on medical leave. So the summertime is when most of the great majority of this practice thrives. It's just because it's a summer vacation area, and it just thrives in this time of year. So this is where all the money is being made. In 3-4 months, do like 30% or 40% of the income in 3-4 months. So what we have is the buyer has signed the contract. Closing has not occurred. But under the circumstances, and the seller has to go out on some short-term medical leave, but it's going to be over a month. So the practice has to keep going. You don't want to bring a temp in right now. So under these circumstances, the buyer is going to work there. I don't like it because the buyer is exposed to it. The staff's exposed to the buyer, but under the circumstances, they're going to work there. And then hopefully go into closing within 2 weeks. So those are some circumstances that I would agree to. Normally I wouldn't, but this is special, extraordinary circumstances. Let it happen. Let the buyer work there, and let's see how it goes. So that's where we are right now. We're going to take the chance, leap of faith. Hopefully the closing goes through, and this way the buyer will work as an employee, but we'll get to meet the patients, keep the staff happy, and prevent them getting nervous and leaving, and keep the ship going while the seller convalesces. Seller just closed the office for about a week, which is normally in between August and July. The seller closed it, and therefore my patients would understand you're closed for 7 days, 10 days. But after that, patients start wondering. So the buyer is going to go in and work there. Contract's already signed. I think it's okay under this circumstance. But most circumstances, I never want the buyer in there working. It's just toxic situation. Start asking maybe the staff to go on a date or something, some interpersonal relationship. Something can happen. There's nothing good that will come from it. So that's what we suggest. Do not let anyone work there prior to closing. If a special circumstance, call me. I'll give you my opinion. Speak to the attorney, get their opinion, get some legal documents signed. Thank you. We have over 550 YouTube videos. Hit the subscribe button and you'll be alerted each time. All right, we are at the beach. It's cloudy, but it's a beautiful day. I love being warm. Bye.